So I'm Bill Wightman, professor of art education, undergraduate and graduate degrees in studio art. I did an MFA in painting, and then I went on for a PhD in art education at Ohio State University. So my trade primarily at JMU has been art education, but I also continue to make art. So the MFA in painting, allowed me to grow as an artist, and because that's a terminal degree, I always thought I would sort of pursue the visual arts, but then I really got interested in teaching. And so the PhD in art education allowed me to think specifically about art education, training students to be K-12 art educators. But throughout all those experiences, I obviously have a passion for still making art and committing to the artistic practice as a way of understanding not only how to become a better artist, but also how to become a better teacher. So this is a painting called Quoque Die, which is Latin for once a day. And I kind of came across the idea, but based on a number of things. One is my interest in post-painterly abstraction and art that's called minimal art. So I'm really interested in that kind of late 70s tradition of painting. But I'm also really interested in conceptual art. And so a lot of my pieces have been very performance-based. I ask questions about faking and identity and age and things like that. But I'm also really interested in everyday aesthetics. And so the colors that you see here represent my prescription medication that I see every day. So these are different pills I take for my health. And I thought it'd be really interesting to provide a very kind of slick, kind of pristine surface and give the colors of the medication that I interact with daily, but to kind of have that as part of the piece, but not necessarily the first thing you recognize when you look at it. So one of the things I really like about the work is maybe you don't know that information, but when you find out what the work is really about, there's this, again, you experience that kind of, oh, can pill colors really be something interesting, right? Or can it be something that's maybe profound, the way that it comes across in terms of a very tight line or a very kind of rich color. So I've tried to honor the way the pill actually looks. So the green color and the orange color, they have a glossiness to them. So I chose a different type of paint that would have that effect. And then the three other colors are those pills are very matte. They don't have a lot of shine. So I wanted to sort of honor that in the painting as well. So from all appearances, it looks like a minimalist post-painterly abstraction composition, but it really has a lot to do with my own daily, once a day interaction with these 5 colors. So so the conceptual quality of the work is what I'm really interested in, and how maybe what is seen as a traditional painting can reflect other kind of directions. In this case, something common everyday aesthetics of the pill colors, right? Things that we commonly kind of interact with, how can those qualities or materials or objects become part of a fine art kind of context, right? Which is what I'm interested in my work. And because my work is also about, in some ways, kind of pushing maybe the question or the definition of what art is, a lot of my performance pieces are kind of questioning that or asking those kind of questions. So this painting for me falls into a lot of my other interest in sort of faking and, just playing with common associations and trying to push them in different directions.